Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Malformations. Malformation, that is Mullarian malformations. In them, first class 1 and class 2. Class 1. Class 1 is called as Mullarian agenesis or MRKH syndrome. In Mullarian agenesis or MRKH syndrome, both the Mullarian ducts are absent. That means if both the Mullarian ducts are absent, then both the fallopian tubes are absent, uterus, cervix and upper vagina are absent, lower vagina is present. This lower vagina develops from the sino-vaginal bulb, ovaries are present and the ovulation is normal here. Second, class 2. In class 2, Mullarian duct is absent only on one side. If the Mullarian duct is absent only on one side, then we call it as unicornuate uterus. In unicornuate uterus, one fallopian tube is present, half uterus, half cervix, and half of the upper vagina is present. So, if there is unicornuate uterus, it is associated with endometriosis, unilateral dysmenorrhea. It is associated with ectopic pregnancy, ectopic ovary, and renal anomalies. One fallopian tube is present and the uterus is banana-shaped uterus.
thank you and thank you for watching.